Cahaba Medical Care is a 501c3 nonprofit community health center. We do primary care, behavioral health, mental health, dental. We're a nonprofit, which means that we have a sliding fee discount schedule to help take care of those who find themselves between jobs, don't have insurance, just anybody who finds themselves needing health care. We tend to locate in communities that may not otherwise have access.
Ensley is a tight-knit community. As you can see in the downtown area, there are a lot of Black-owned businesses here. It's rich in heritage.
Ensley is part of Birmingham. My father grew up here, so there's a rich family history here in Ensley. He is also an OBGYN physician, so this location has significance to me in terms of extending his legacy of serving the women of this community. The people in Ensley are very, very happy that we're here. They're usually very surprised at how beautiful it is on the inside. The clinic is located in the business district of Ensley. Back in the 20s, 30s, the steel industry was big and this was a booming area. Over time, there has been a lot of vacancies here and a lot of the properties have been run down. And our hope is that as people like myself invest in the community, that others will come. And there certainly are others here working on that same effort. The area in general, predominantly African-American patient population within the 5-mile radius from here. Since being here in 2007 when we purchased this building, I've seen other investors, if you will, come into the community and purchase buildings and put in some businesses so that hopefully this area will thrive again. My introduction to medicine was through my father. He expressed a lot of joy and satisfaction for the patients that he served. That led me to explore a career in obstetrics and gynecology, and more specifically, serving underserved populations.
I love the patients here. I love to serve, and I want to care and love for people who may feel forgotten about. It is a joy to serve this population. They are so thankful. They are really excited to be here and excited to get good care, and you don't find that everywhere.
It's important for patients that don't have insurance to understand what the healthcare system is going to do to their finances. So what we do here is have a sliding fee discount schedule. It's very transparent, unlike so much of what happens in healthcare nowadays. Our goals at Cahaba is to be a part of communities.
I think it changes the culture of a community. If you have good health care, I think it makes the community thrive. This clinic has been a staple because of the history with Dr. Ashford's father, so it's been a staple in the community. I know my experience when I first came to Cahaba, I was just like blown away that there was another Ashford here providing service and giving service to women, and especially women of color.
I think it's important for patients in this community to see providers that look like them, and hopefully that inspires them to enter the field of medicine, not necessarily to be a doctor, not necessarily to be a nurse, but there's a whole range of occupations that as they walk in here, they can see and say, hey, maybe I can be that person one day. And so I think that has an important place in my heart in terms of the legacy that we want to leave here.
We're a teaching program, so we have not just doctors in training, but nurse practitioners, medical assistants, social workers. We want to transmit this down to the next generation, which in turn brings more people into this community of service. And so really at the end of it, we just want to be a catalyst for this type of healthcare and community transformation, just being good neighbors.
I always go by the motto, don't do anything about me without me. So I know it's so important when you go into a community that you listen to the concerns and the needs of those persons in that community. This team here is dynamic. They are caring. When they saw me, they always had a smile, and I look forward to coming to my visits. And that's important, especially when you're pregnant, and especially as an African-American woman, that's important to be seen, and for someone to know you by name, call you by your name, and just recognize you not just being a patient, but someone to say, hey, how's your other children? How are you? And I think that's special. I mean, if you look at Dr. Ashford, he is so soft-spoken, but his words are so powerful.
You know, this is something that for me really doesn't feel like a job. It feels like a calling to me. And there's this tremendous sense of gratitude that these patients have that really drive me. And knowing that I can make a difference, it's not a job for me. This is really just a passion, a calling that brings me here every day.